everybody, it's Dr. Dave, Psychiatry. Thanks for coming to this channel today. Appreciate you being here. I saw a new patient this morning for a first-time evaluation, and it prompted me to want to make this video today. So without identifying her, I'm going to tell the story roughly about what happened. And I hope it generalizes to all of you, because the truth is, coming to see a psychiatrist is a pretty threatening thing. I said that before, and I did a video before about how the walk into the psychiatrist's office is probably the longest walk an individual feels like they've ever had. Some people described it that way. So this gal coming today was a little bit nervous about seeing me. She had moved from another state. She had had a psychiatrist in the past. She'd had treatments since she was younger, I think even in her teens, maybe a little before that. But the point was that she hadn't been in treatment for a while, and she was not feeling well, and she was really uncertain about what was going to happen. So I did my normal thing, told her that I was a brain chemistry guy, not a talk therapist, established the initial understanding of where she'd come from, what medicines she'd been on, and then asked my questions about the different symptoms, went through the symptom checklist, and asked her about the symptoms of depression, anxiety, and attention deficit disorder, all the things that I normally, overthinking, all the things I normally do. So we went through that whole process, then initiated the troubleshooting process. So if you haven't seen the troubleshooting brain chemistry video, that gets directly to that. That's what we do as soon as we collect the symptoms. I want to teach people about how to troubleshoot brain chemistry the same way they would troubleshoot a computer or a car that wasn't working properly. So at the end, having developed a plan, discussing the options, deciding which chemical we were going to push up or which chemical we were going to push down, teaching the terms suppressor and booster the way I do in the office, and hopefully you understand that by watching these videos. She looked at me and she just looked so much more relaxed, and she used a phrase that I just wanted to trap. She said, "I feel so much better just knowing." Now the truth is, she hasn't taken the medicine that we decided for her to take yet today. She just felt better knowing what we were doing, what the plan was. Despite the fact that she had had previous doctors and psychiatrists, she really didn't know the names of the chemicals, or the chemicals, in fact, how they worked, how the medicines worked on the different chemicals. So getting the basic understanding, as I try to teach with this channel, about serotonin boosting, norepinephrine boosting, GABA boosting, dopamine suppression, the four big things that we do to help people. She just felt so much better knowing that someone was there that was able to articulate the reason that we're doing something. And it was an instantaneous relief for her to simply know that this wasn't just medicine that we throw at people. Why is that important to tell the story again? Well, number one, I think it's validating for the channel. It's validating that you're spending time here. I know already that people have come to they have become more educators of the people around them by virtue of thinking about the medicines they take and utilizing the YouTube channel to teach others that are around them. So I think it just speaks to the fact that if anybody ever gives you medicine and says, "Here, I hope you feel better," it's just not enough. And it's really good for anybody, whatever medical problem they have, to be educated about why they're getting it. So I'm very happy that I met her. I'm very happy that she felt just better just knowing what we're going to do. And I want to share that story with you today. So thanks for coming to the channel. I'll keep posting these every Thursday. So if you're subscribing, you know about that. And I hope that they're helpful to you. I'm Dr. Dave, Psychiatry. Thanks for coming to see me today.